Hey guys, welcome to Parenting Mom Style, and today we're doing a live session. I hope I'm audible to everybody. Welcome to Parenting Mom Style, and today we're doing a live session talking about hygiene in babies during pandemic. So do let me know in the comments if I'm audible and or if you want me to make some adjustments. Today we're going to talk about hygiene in babies during COVID-19, and we are going to talk about babies in particular because most of the parents know what to do with older children, but when it comes to babies, they're a little worried because they feel a little confused and intimidated as to what to do when it comes to handling babies during a pandemic. So let's get into the topic. If you've joined just now, let me just remind you that I'm Dr. Kavya. I'm a pediatrician practicing in Bangalore. And today we're talking about hygiene in babies, especially during COVID-19 pandemic. Before we start the session, I just want to remind you that go ahead and tag your friends in the post so that they don't miss the session. And if you have any queries regarding child health or any queries at all, do let me know in the comments so that I can answer it after this towards the end of the session. Let's start the session. So talking about hygiene in babies in particular, I want to emphasize the fact that this isn't just limited to the period of pandemic. These are general guidelines that a parent or a new parents or parents should follow for their entire lifetime, in fact. When we are talking about hygiene, I want to remind you the fact that improving personal hygiene has shown to reduce the frequency of infections in children as well as in adults. So simply by improving your standard of hygiene, you will be reducing the number of visits that you make to the hospital. Talking about hygiene, so I'm going to talk about hygiene in babies in two broad categories. One is the personal hygiene, as to how to take care of the baby, what you're supposed to do. And we're going to talk about environmental hygiene, how to keep these surroundings around the baby clean so that there are less chances of infection, whether it is COVID or any other virus or bacteria. Talking about personal hygiene, first and foremost, hand washing. Hand washing, I cannot emphasize enough on hand washing. It is really, really important to wash your hands before handling the baby. And one thing I want to point out is that it is important to wash your hands using a soap or use a hand sanitizer with at least 70% of alcohol. And when you're washing your hands, it is also important to know the technique of washing the hand. Yes, we do wash our palms, and that is great, but most of the bacteria are known to reside in the crevices. That is these areas, and also around your wrist line and on the back of your hand. These are areas that do not touch many surfaces, but at the same time is a good place for the bacteria or virus to reside. So I just want to tell you that when you're washing your hands, take care to make sure that you wash the back of your hands as well as wash your hands up to your elbow, especially when you're handling a newborn or smaller babies. And while hand washing, you have to make sure that you use a soap. Any soap will do. And you have to make sure that you can use a sanitizer with more than 70% alcohol. And when we are talking about hand hygiene, it is also important to make sure that your fingernails are trimmed properly so that any bacteria residing in the fingernails do not cause infection for the baby. The second most important thing when it comes to personal hygiene is bathing your baby. So bathing, one of the common questions that I get asked about bathing, especially newborns, is when should I start bathing the baby? How frequently should we do it? So usually the first 10 days, you do not require to bathe the baby. It's enough if you give sponge bath. But after the first 10 days, or especially after the umbilical cord has fallen off, it is important that you bathe the baby every day. So when it comes to bathing, one of the most frequent questions that I get asked is which soap do you use? So when it comes to soap, I want to share my own personal experience with you. My son, who is about a year and a half, has really sensitive skin and very dry skin, just like me. I have very sensitive skin, so does he. So when we started using products for him, he used to get rashes very frequently. So I started doing a lot of research and putting in a lot of time worrying about ingredients that are present in soaps, so that the ingredients do not harm the baby skin. And it's not just my son. A lot of patients of mine tell me that their baby skin are very sensitive, and that is true. Baby skin in general are really sensitive, and exposing them to chemicals can be really harmful. They develop rashes really quickly, and they develop reactions to new chemicals very quickly. So one of the important things to know when using a baby soap is that make sure it is hypoallergenic. Make sure the product mentions that it is hypoallergenic. When I say hypoallergenic, it means that the product has been tested and known not to cause any allergy for any skin type. Okay. Second thing is make sure that the chemicals, there are no chemicals in the, there are no harsh chemicals in the baby soap. So especially parabens. So make sure you look for the label that says no parabens, and also fragrances or preservatives. It's also important that the any baby product for that matter does not contain any fragrance or any preservative. So like Akanksha is asking me here again, which soap is best? So we're talking about which soap is best. So it's important, like I said, these points. So let's recap. No parabens, no preservatives, no fragrances, and hypoallergenic. One of the, in my personal experience, what I've been using is Bioderma Atoderm Pa. It is an intensive cleansing agent, and it's been doing really good with my son's skin. He's never developed a rash. And in fact, it is so nice that I've been using it for myself as well, because I have sensitive skin as well. So one of my personal recommendations is to use Bioderm. Bioderma is a very good French company, has very good reputation. So I do not have any anxiety about starting the soap, and it actually worked out great. And because it has shea butter, I also found that it is very moisturizing. It doesn't dry out the skin. So that is about bathing the baby. The second thing that I would, the third thing that we should talk about is when it comes to babies, in terms of personal hygiene, there are other things like you have to clean their ears, you have to clean the eyes, and you have to clean the nose, and also clean the teeth. So we're going to talk briefly about these things. So when it comes to cleaning the ears, do not use any earbuds. Just simply wipe the external ear with a soft cotton dipped in warm water. That should be more than enough. The ear has hair follicles that pushes the wax outside. So you don't have to clean the inside of the ear. Your body does that for yourself. So simply take a cotton bud and clean the external ear, and that is more than enough. And again, I'm looking at the comments and I'm getting a lot of questions on which soap do you use. Even in my daily practice, this is one of the most common questions that I get. And hi Aishwarya, hi Swati, thank you for your comments. And Swati is asking me, I'm using Bioderma Atoderm Bar for my son. I love the cleansing bar, and that is great because I've been using it myself for about a year now, and it's really great. So let's get back to the topic. So talking about ears, I said don't use any earbuds whatsoever. Simply clean the external ear, and that is more than enough. If you see excessive wax accumulation in the ear, you can go to a ENT specialist or a pediatrician and ask them if there's any reason why there might be excessive wax. And usually there is, and they will guide you properly. The third thing is cleaning eyes. The mucus in the eyes can get accumulated, so use a soft cotton cloth, clean soft cotton cloth, dip it in warm water, and simply clean the eyes from the inner side to the outer side. Gently clean the eyes. This you can do every single day. And cleaning the nose, a normal baby does not require his nose to be cleaned. Only the dried mucus parts can be gently cleansed off using again a soft cotton cloth. But if your baby has cold, then you can use a nasal aspirator that is usually available in all pharmacies or online stores. And cleaning the gums and teeth. This is one of the common things that we see. When it comes to cleaning the teeth, most parents are like, my baby doesn't have teeth yet, so I don't have to brush his gums or anything. I don't have to clean his mouth. That is one of the misconceptions that is commonly seen. Even though your baby does not have teeth, the teeth are there, but they're yet to erupt. They're there inside the gums. So any kind of bacterial overgrowth that can occur in the mouth of the baby can cause caries even in a teeth that has not erupted. So I want you to keep this in mind. So even though small babies do not have teeth, you can take a soft cotton gauze, dip it in warm water again, and gently cleanse the cleanse the gums. Of course, once your baby starts getting teeth, it's important to brush the teeth using a soft bristle brush and using toothpaste which does not contain fluoride. So we've talked about bathing, cleansing eyes, ears, and nose and teeth. And also one of the other things is cleaning the genital area. Most parents use diapers, and because of this, a lot of debris like feces get accumulated in the diaper, and this can sometimes cause urinary tract infection, and this is really common. So make sure that every time you do a diaper change, you clean the genital area, whether it is a boy or a girl. Clean the genital area using a soft, clean cotton cloth. And make sure to wash your hands before cleaning and after cleaning so that you don't give any infection to the baby, especially to the urinary tract. So that's about personal hygiene. So for those of you who are joining right now, I want to just do a quick recap and say I'm Dr. Kavya, a pediatrician. We're talking about hygiene in babies. And so today in this topic, we've covered about personal hygiene. In terms of personal hygiene, we've been talking about first thing is hand washing. Keep your hands clean as well as your baby's hands clean. Use a soft cotton cloth and wipe his hands often because babies tend to keep their fingers in their mouth and therefore risk infection. Second thing is bathing, and I'm getting a lot of questions on which soap to use, and we've talked about which soap to use and how to look for. My personal recommendation is Bioderma Atoderm, and I'm also getting questions on toothpaste. Look for toothpaste which does not have any fluoride. We've covered that so far, and we've talked about cleaning eyes, nose, ears, and tooth, and we've also talked about cleaning genital area. These are about personal hygiene. I also want to talk about hygiene in your environment, in the immediate environment of the baby. This is extremely important because you might keep the baby really clean, you might be keeping yourself very clean, but if the environment harbors any infective agent like virus or bacteria, that can easily spread to the baby. So when it comes to environment, I want to talk about food hygiene. Food hygiene first. I'm looking at the comments and I'll definitely answer them towards the end of the session. And when it comes to food hygiene, if you've started food for your baby or for older babies, what you can do is make sure you wash your hands before preparing the food and before feeding your baby. Also make sure you wash your children's hands because they tend to keep their fingers in their mouth very frequently. So that is one thing when it comes to food hygiene. And also the second thing is to make sure to wash the vegetables thoroughly. And I'm looking at the questions, and Jyoti Swarupa, hi, and she's asking me which lotion is best in summer for children. Lotion, again, Swarupa, I would say that keep the points that I told you in mind. And I've been using actually Atoderm from Bioderma range because I have personally used it for years, and I found that it is really helpful, especially for babies with sensitive skin and dry skin, because it is very moisturizing, and it is hypoallergenic, which means it does not cause any reaction. So you can use the Bioderma Atoderm intensive moisturizing lotions. And getting back to the topic, so we've been talking about food hygiene. So make sure that you wash your hands and also wash the vegetables and fruits or whatever products, food ingredients that you use thoroughly with water. And sometimes fruits need to be washed in warm water, warm soapy water, so that any residual debris that is present on the fruits, any chemicals that may have been used, are washed off thoroughly. So make sure to wash your hands before preparing the food for babies, and wash your children's hands before they start eating, because obviously they're going to be involved in the process of eating. And third, you have to make sure you wash the vegetables and food ingredients thoroughly. Second thing is toys. Babies start playing with toys by about second or third month. You will start giving them rattles and stuff. So it's really important to wash the toys as well. Make sure you wash the toys at least once a week, and if you have the time, make sure you wash it at least twice a week, and use warm soapy water to thoroughly wash all the toys. If your toys do not contain, make sure the plastic that you use are of good quality. Therefore, the toys can be washed in warm water and do not release any toxic chemicals. What happens with plastic is that sometimes when they're exposed to warmth or heat, they tend to release toxic chemicals, which can be really harmful for human body. So talking about that's how to keep the toys and environment in a good hygiene. And the third thing is feeding bottles. Yes, a lot of mothers, if you're working like me, you tend to use feeding bottles. So make sure you use a sterilizer to clean the bottles every single use. This is really, really important, because we get a lot of questions and we get a lot of patients who come in with repeated respiratory infections, and they're always asking me, why is this happening? Why is my baby having repeated respiratory infections? It's because of the feeding bottle. If you do not clean the feeding bottle properly, you're simply introducing bacteria and virus into the baby. So make sure, if you are using if you're using feeding bottles, you are cleaning them properly. So hi Anu, Anuradha is asking me, what are the precautions we should take in the COVID time, especially for babies? Hello Anu, if you've just joined in, we've been talking about hygiene in babies. In hygiene, there are two things: personal hygiene and environmental hygiene. I'm going to do a quick recap in the end, so stay tuned till the end. So we are talking about environmental hygiene. In environmental hygiene, we talked about food, we talked about how to clean the toys, and how to clean the feeding bottles. Yes, feeding bottles, make sure you sterilize them every single day, and make sure you use sterilized bottle for every single feed. Okay, so that is about the environment. And the fourth thing is cleaning the surfaces in your house. When you have babies who have started crawling, who started walking, they tend to touch all the common surfaces, floors, tables. So it's very, very important to clean the surfaces in your house, especially things like doorknobs, handles, tabletops, coffee tables. These are really easily accessible surfaces for babies, and they keep touching these surfaces and they keep putting the fingers in mouth. So one thing you can do is that you can use any disinfectant agent or any agent which has more than 70% alcohol, and wipe the surfaces at least once a day. What I used to do is that I used to make it a habit to wipe all the surfaces before I went to bed. That way, the next day, all the surfaces are clean and I don't have to worry the whole day about any infection. This is a really simple routine. It'll take about 10 to 15 minutes, and it's not that tasking. So definitely do this every single day, especially if you have babies who've just started crawling. So use any disinfectant agent, wipe off all the surfaces, doorknobs, tabletops, before you sleep, so that the next day it's really refreshing for your baby and you can be worry free. So these are things that you have to do in your environment. I guess we've covered most of the important things. I'm going to be looking at the comments. Shrishti Mehta says, hello ma'am, what should be an ideal skincare routine? So if we are talking about ideal skincare routine, thank you first of all Shrishti for a good question. If it's an ideal skincare routine for, I assume, for babies, first thing is bathing. So babies over 10 days have to be bathed every single day. You can give them an oil massage before bathing, because the fats in the oils tend to get absorbed through the skin, and they usually they aid in weight gain. In the ICUs, when we have really small babies around 800 grams and 1 kilo, what we do is we give oil massage every single day so that the fats in the oil gets absorbed in the skin and they help in weight gain. So, and also baby massage is really important for development of the baby. The stimuli that the mother gives is really, really important. So what you can do is give oil massage every single day. Wait for about 10 to 15 minutes, even an hour if you can, and then bathe the baby. When it comes to bathing, use a good quality soap. And I've been getting a lot of questions about recommendations. We've talked about that. You can use Bioderma intensive cleansing bar. That's what I've been using, and it's really good, especially if your baby has sensitive or dry skin. And after you bathe the baby, make sure you immediately apply the lotion. Usually when you bathe the baby, what happens is that the moisture, the water seeps into the skin, and the water content is in the skin, but with time this water content gets evaporated. This happens with your skin as well. As soon as you wash your face, you feel refreshed because the moisture content in your skin is increased. To keep this moisture content locked in your skin, you have to apply the lotion immediately. So you can use a good quality lotion. Again, Bioderma is a great brand that I've been using. So you can use a good lotion, and good lotion so that you lock the moisture content of the baby. So this is usually a really simple routine, but a very essential routine. You cannot skip any of these steps. These are the basic 3 things that you have to do. Oil massage, bathe the baby every day with warm water, and third thing is baby lotion immediately after bathing the baby. So those are 3 important things that you have to do. One more thing is diaper rashes. Again, this comes as part of the skincare routine. Make sure that you change diapers very frequently so that there are no rashes in the baby. This is again really important. So let's look at some of the questions, because I think we're done with the topic. And if you want me to do a quick recap because you've just joined in, do let me know in the comments below, and I'll do a very quick recap so that you're caught up on the topic. Of course, you can catch this live session even after stopping it. So you can definitely watch the live session again to know all the points that we've talked about. So, hi Shravya Shri, she says, I want to know, can we use the baby product for ourselves? This is a great question. Yes, Shravya, definitely you can use it for yourself. I personally have really sensitive skin. Like, I break out every 3rd day if I use something out of routine. So I actually use a lot of baby products. I don't know if I should say this, but I do use a lot of baby products. And also I get a lot of samples, so I wouldn't know what to do with them. So I use a lot of baby products for myself. And anybody who tells me that they have sensitive skin, I recommend baby products for them, because baby products are made for sensitive skin of the baby, and why not use it for yourself? So you can definitely use baby product for yourself. Pavani Arjun is asking me, how can thumb sucking be controlled in teething babies? Thumb sucking, there is a misconception around thumb sucking. Let me just simply explain that thumb sucking for babies is a very comforting experience. You don't have to worry about thumb sucking in smaller babies, because trust me, it does not become a habit. The reason they might be sucking may be a clue to something else. Like, for example, they might be sucking their thumbs when they're hungry. So make sure they're well fed. They might be sucking their tongue, especially during falling asleep, and you probably would have noticed this more frequently. So thumb sucking is a comforting experience in smaller babies. So if your baby is less than 1 year of age, you don't have to worry about thumb sucking, and it is a comfort. It is a matter of comfort for the babies. In fact, babies have known to suck at their thumbs or arms even inside the uterus. So don't worry about thumb sucking in smaller babies up until 1 year. After a year, you can slowly use different techniques to get wean off of thumb sucking. And usually after a year, you don't see that many babies that suck on thumb. And even if they do, as they grow up, usually by 3 or 5 years, they usually get rid of this habit. And thumb sucking has been related to a lot of anxiety as well, and this is in older children. So if you have an older child like 5 years or older who is sucking their thumbs, it could be because of some anxiety or some problem at home, like parental separation or some sort of some bullying at school. These can give rise to these problems. But if you're asking me about smaller babies, especially teething babies, do not worry about thumb sucking. It is completely benign and you don't have to do anything about it. So going to Saumya's question. Hi Saumya, welcome to the session. Due to lockdown, vaccination are missed. How long can we delay vaccination? This is a very common question that I get asked. Yes, vaccination is really important because it helps prevent infections in your babies. So I wouldn't recommend missing vaccinations, but these are special circumstances. Special circumstances where you have to outweigh the benefits versus the risks. So I would say it's okay to delay the vaccination at this point until the lockdown is over, because the risk of catching an infection when you go to a hospital setup is far more than staying at home safe and sound without vaccination. So the benefits of staying at home is much more. So do not worry about vaccination. In an ideal situation, let's say there's no pandemic, then vaccination, I wouldn't recommend delaying more than 30 days. Depending on the type of vaccine, beyond 30 days, we have to readjust the schedule so that we give you a different schedule so that you catch up the vaccination. It's called catch-up vaccination. But at this time, because of the pandemic, yes, it's okay to delay the vaccination, wait until the lockdown is over. And if this, let's say, gets indefinitely increased, the lockdown gets increased, then what you can do is you can call your pediatrician. My few suggestions is that go to a maternity hospital, because there usually you won't find other patients. It's only moms and babies. So these OPDs do not usually have other patients. So the risk of catching an infection will be less. Make sure you get first or a last appointment so that you don't have to go and sit and wait in the outpatient place for a long time. And make sure you call your pediatrician, ask them if they're available for vaccination. And if it is a prolonged process, this lockdown, then you can call, make an appointment and get your vaccination done. But for now, it's okay to wait until the lockdown is over. So Mekala is asking me, what ingredients should I check in baby products? That's a great question. Mekala, we've covered this, but I'm going to recap. So you have to make sure the baby products do not have any parabens, do not have any fragrances, do not have any preservatives. These are very important because these chemicals cause irritation of the skin. So no fragrances, no preservatives, no parabens. These are very important. And when it comes to ingredients, make sure they have moisturizing ingredients like shea butter, glycerin. These are great for skin and also are very moisturizing. So Shrishti is asking, my baby is 3 months old. Can I use soap on his face, and what all precautions should I take during this COVID? So hi Shrishti, thank you for the question. And yes, we've talked about the precautions so far. Irrespective of what age your baby is, you can use soap on his face. Usually baby soaps are meant to be used head to toe. They do not cause any irritation of the eyes, so you can use that. I've been using Bioderma Intensive Bar, which is a really good cleansing bar, and it so far has not caused any problems for me, and it is really great, especially for sensitive skin. So I'm going to next question, which is the best sanitizer that can be used for babies? I wouldn't say there's anything called best sanitizer. Look for sanitizer that has more than 70% alcohol. The higher the alcohol content, the better. Some of them have more than 90%, which is also great. But the minimum that it should have is more than 70% alcohol. Alcohol is the best disinfecting agent, so sanitizing agent. So use any hand sanitizer which is more than 70%. In a hospital setup, we usually use Sterilium, which is great. But I would say any hand sanitizer is fine as long as it has more than 70% alcohol. Can we use can we use sanitizer to baby, or is soap best? I would say do not use sanitizer on smaller babies because they tend to put the hand in mouth, because alcohol is also a toxic agent. Leaving the hand sanitizer for too long on the baby can be a little worrisome. If you do use, you have to make sure it is dried really well before you can leave them alone unsupervised or anything. But I would say if you want to sanitize their hands, the best way to do it is use a baby is great. Wash their hands if they're older babies. Smaller babies who are, let's say, less than 3 months, they are always on the bed. You cannot keep taking them to the washroom. So what you can do is you can just keep a bowl of warm water, use a baby soap, and wash their hands. That should be good enough. And hello, Dr. Sakshi. Using Bioderma Atoderm 2, best one for my for all skin types. Oh, thank you so much. That is great. And Shravani is asking me, my sister's baby skin is very oily. Any tips? You don't have to worry about oil in baby skin because oils are good. Oils keep the skin moisturized. I can tell you why baby skin might be oily. The reason why any skin, whether it is baby's or your skin or anybody's skin is oily, is when it is dehydrated. So a dry skin, as a compensation, when there is less moisture in our skin, as a compensation, the skin starts producing oils so that it can restore the moisture. What does oil do? Oil repels water. So whatever moisture is left in the skin can be restored, can be protected by creating a layer of oil on top of the skin. This is compensatory mechanism that our skin follows. So any baby whose skin is oily, the reason it might be is because they are dehydrated. So what you can do is make sure the baby is, if it is a small baby, make sure the baby, usually bathe them with a good moisturizing soap. And immediately after bathing, you can apply a lotion so that the moisture is locked into their skin. Next question, any tips for breastfeeding moms? Breastfeeding moms, I assume in terms of hygiene, make sure you wash your hands before you breastfeed. You have to wipe your breast before every feed. So keep a clean cotton towel with you and simply with warm water, just wipe your breast before you offer it to your baby. That is one of the important things. And because our skin naturally has some bacteria residing on it for prolonged time that can increase and can cause infections. But otherwise, I don't think you have to do anything additional other than just wiping your breast before giving it to the baby. Girija is asking me which cream is best for kids in summer season. When it comes to lotions and creams, I would say keep the ingredients in mind rather than any particular lotion. I've been using Bioderma for myself, and it is a really good lotion, so I think that is great. That is my personal recommendation if you want to know. And Vaishali Hi is asking me, ma'am, which shampoo is best? My kid has dandruff. He's 12 years old. For older children, it's important to understand why dandruff occurs. Dandruff is a fungal infection. So sometimes if there is a fungal infection of the scalp, kids can have dandruff. So you can use any shampoo. You can go to a pharmacist, ask for a shampoo which contains ketoconazole. This is about 2 to 3% of ketoconazole shampoos. They usually do not have a brand as such. Just ask them for antifungal dandruff shampoos in a pharmacies and they'll give you a shampoo. This usually takes care of the dandruff problem by curing the fungal infection. So I hope that's helpful. Kavya, hi. She says, is there any shampoo in Bioderma? Bioderma, I am not aware if there's any shampoo, but I'll definitely do a research and get back to Kavya. Thank you for the question. Garima says, my baby skin has small breakouts on skin. What's that, ma'am? She is 2 years old. Usually because of excessive oil production, it is possible that sometimes, Garima is also asking, is it eczema? So eczema is dryness of the skin and which usually gives rise to scaling of the skin. So this can get exacerbated by using chemicals, harsh chemicals on your baby's skin. It is difficult to diagnose without, of course, looking at the baby, but I'm going to tell you these things, these tips to make sure that the boils are much lesser. So usually what happens is that there is a lot of oil production, and therefore the oil production, like we talked about, can be because of dehydration. So this can give rise to sometimes dry, scaly skin, which can look like eczema. But what you can do is make sure you use, and eczema, I have to tell you that any chemicals you use gets exacerbated like crazy, and it's difficult to control once it gets exacerbated. So if your child has dry skin and boils because of this oiliness, use a soap that is, you can use baby soaps irrespective of the age. So use any soap that is chemical free and therefore has moisturizing contents and is hypoallergenic, so that they don't get boils as much, and therefore being sensitive skin, it is much more useful. Okay, so I'm looking at all the comments. Rashi says, nice session, ma'am. Thank you so much, Rashi. Please tag your friends. Ipsika is telling me, how long can I delay my son's fungal infection mask and repeated infections from blood tests and doctor checkup? Okay, so if your son is having I'm using an antifungal soap. Okay, so Ipsika is asking me if there is a fungal infection of her son, and if she's been using a antifungal soap, how long can she delay a doctor checkup? Fungal infections, Ipsika, takes a long time to cure. So I would suggest wait. If there are no other symptoms, it's okay to wait. Use an antifungal soap and antifungal shampoo. Make sure you bathe your child every single day and change clothes, and make sure those clothes are segregated properly, because fungal infections tend to be very contagious. It can easily spread either way, from your son to you or you to your son. So make sure the clothes, handkerchiefs, and everything is properly disinfected and washed every single day, and continue using the antifungal soap. It takes about 2 to 3 weeks and sometimes months for fungal infections to come down. So what we usually do is we give antifungal medications, like topical antifungals like shampoos or soaps, for about 2 to 4 weeks. If the infection does not get controlled, or if it worsens, if it's the same, there's nothing to worry. It'll take time to get controlled. But if it increases, then we usually start on antifungal oral medications like tablets or syrups. So you can wait until 4 weeks for the fungal infection. Usually it gets cured after 4 weeks. If it doesn't, then you may have to visit your doctor. Rasagna says, good information. Thank you, Rasagna. Rashi is telling me how to cure scabies in baby currently undergoing Ayurvedic treatment. Rashi, I cannot comment on Ayurvedic treatment because I do not know about it. I can only talk about allopathic medicine, which I am an expert of. Scabies is not it's a very common infection. You don't have to worry about it. And it is common in babies as well. I would suggest, Rashi, to a doctor, so that they usually give you treatment for 2 weeks and it gets completely cured in 2 weeks. If you're fond of Ayurvedic medicine, continue that, but use allopathic medicine as well. So your doctor will usually prescribe you a blue color lotion that you have to apply on the baby and then bathe every day. It is really simple and gets completely cured by 2 weeks. But Rashi, I want to tell you that it is very, very contagious, that it spreads rapidly. So you have to be very careful. If you have other children around the baby, make sure they are separated, and again, wash the clothes properly. Rohini is asking me, can we use sanitizers for small kids? Yes, Rohini, you can use sanitizer for small kids, but make sure that after using the sanitizer, the hands are completely dry before you allow them to play or do anything else, because sanitizer contain alcohol, which can be toxic. So immediately after using a sanitizer, if they put the hands in the mouth, that can be dangerous. So make sure the hand dries really well before they start playing. Parnita is asking me, is sunscreen best for babies? I'm not using it though. I do not understand why babies need sunscreen. Please don't use a sunscreen for baby. Babies need sun. They do not need sunscreen. So if your baby is playing in the sun and he's getting a little darker, it's okay. He needs the sun. What happens is that sunscreens, they block UVA and UVB rays are especially important for synthesizing vitamin D in our skin. So using a sunscreen, you're blocking vitamin D from being synthesized. And let me tell you, vitamin D from vegetarian sources is very difficult to get, and usually you will have to eat meats, organ meats, which have good vitamin D, or fish oils. So what I would say is the best source of vitamin D is sun. Do not apply any sunscreen for babies. Instead, let them synthesize vitamin D, which is far more important. So use a simple moisturizer that is good enough just to protect the skin. Otherwise, don't use a sunscreen. Parinita says, very nice session. Thank you, Parinita. Kavya is asking me the same question. Can we use sunscreen for babies? Like I said, babies don't need sunscreen. They need sun and vitamin D for strong bones. And let me tell you that vitamin D helps in the absorption of calcium. So if you have low vitamin D levels, you will have low calcium levels and not very strong bones. So it's very important that babies get enough sun. Make sure that your baby is getting at least 30 minutes of sun exposure every single day. So that is about vitamin D. And a lot of people think because we live in a hot climate, we don't have vitamin D deficiency. That's not true. Vitamin D deficiency is 80 to 90% prevalent in India. So do not use sunscreen. Nero is asking lotion or cream, which is best? Is there a difference? Nero, the difference between lotion or cream is in the composition. Creams are much thicker and lotions are much lighter. They are meant for much easier penetration into the skin, and therefore lotions have ingredients that helps hydrate the skin, whereas creams are meant to be a layer on the skin which protects the hydration underneath. So I would suggest is if you're very, very dehydrated, use both. Use a lotion underneath, and once it dries a little, then apply a cream layer so that that moisture is protected. But if you're not for a routine, either of it does not matter. Monica says, good session. Thank you, Monica. As a doctor, what is your message to all moms like us? So difficult for us to hold on to our kids back at home. I know, Monica, it's but think of it in a positive, more optimistic way, that you're getting time to spend with your kids and also with your family. Use this time to build good habits in your, like reading, writing, even playing outside. Yes, now it's difficult to send your kids outside, but you can use this time to incorporate good habits in them, spend more time with them. Then Anuradha is asking, what is the use of sunscreen? Is it really effective? Yes, sunscreen. Sunscreens have something called SPF, sun protection factor. This SPF factor has to be at least 50. I do not see the point of using SPF 15 or SPF 30 even. At least make sure your sunscreen has SPF 50. That is for the protection from UVA rays. And there's something called PA 3+. You have to look for plus signs. Usually it has to be at least more than 3+. This is for the protection from UVB rays. This is for more for adults. Sunscreen for children, if they are older children, like let's say more than 10 years, you can use sunscreen. But I would say sunscreen at all point is not required. Their skin is really healthy. They can sustain any sun exposure, at least 30 minutes of sun exposure, so that they get vitamin D. For older children, of course, you can use sunscreen. It is really effective. So Shrishti says, hello Shrishti, she says, please suggest immunity boosting foods. That's a good question, Shrishti. Immunity is our body's innate function to block infection. So when you're talking about immunity boosting foods, use a lot of vitamin C, vitamin A and vitamin D foods. So a lot of citrus fruits like oranges, even red bell peppers, lemons, these are rich in vitamin C. Vitamin D, a lot of meat products, non-veg options, and again, sun exposure. And there are again a lot of things that we use in our daily life like garlic, turmeric, ginger. These spices are known to boost immunity for a very long time, and especially garlic has been in the spotlight lately. It has been proven in many studies that it is immune boosting. So I guess Indian food is packed with immune boosting foods as it is. And Girija says, very useful session, ma'am. Thank you, Girija. I hope we can do more sessions like this if we have your support. So that's about it for today, and I want to do a quick recap before we wind up. So today, for those of you who missed the session, today we talked about hygiene in babies. And in terms of hygiene, there are two things that you have to remember: personal hygiene and environmental hygiene. In personal hygiene, we talked about hand washing and hand hygiene, trimming fingernails and washing your hands frequently, washing a baby's hands frequently, cleaning ears, nose, eyes, and cleaning their gums. And also we talked about how to keep the genital area, diaper area clean, especially in babies. And in environmental hygiene, we talked about food preparation, how to make sure that your food is not contaminated from bacteria or viruses. We talked about cleaning toys, and we talked about cleaning feeding bottles, and we talked about cleaning surfaces, commonly touched surfaces in our house. So thank you for having me on Parenting Mom Style. I hope you've had something to take home from this session, and thank you for all your support. So I hope we can do more sessions like this. So I'll see you around.